In this video by Deckplate we will be discussing how obesity, OSA and mental health can cause hypertension. Some of the most common obesity, OSA and mental health conditions can cause hypertension experienced by military personnel. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. How obesity, OSA and mental health can cause hypertension. Obesity, obstructive sleep apnea, OSA, and mental health can individually and collectively contribute to the development of hypertension through various interconnected mechanisms. Here is how all these conditions can cause hypertension. Obesity is a condition characterized by excessive accumulation of body fat, often resulting in a body mass index, BMI, of 30 or higher. Causes contributing to hypertension. Increased adipose tissue produces inflammatory substances and hormones that disrupt blood vessel function. Insulin resistance associated with obesity can contribute to elevated blood pressure. Greater blood volume is required to supply excess adipose tissue, putting strain on the cardiovascular system. Obstructive sleep apnea, OSA. OSA is a sleep disorder characterized by recurrent episodes of partial or complete blockage of the upper airway during sleep, leading to disruptions in breathing. Causes contributing to hypertension. Intermittent hypoxia during OSA episodes triggers sympathetic nervous system activation and stress hormone release, elevating blood pressure. Chronic inflammation and endothelial dysfunction, resulting from repeated cycles of oxygen deprivation and arousal, are linked to hypertension. Mental health. Mental health encompasses emotional, psychological, and social well-being, affecting how individuals think, feel, and handle stress. Causes contributing to hypertension. Chronic stress associated with mental health conditions activates the sympathetic nervous system, leading to increased release of stress hormones and elevated blood pressure. Unhealthy coping behaviors, such as overeating, smoking, or excessive alcohol consumption, often accompany mental health issues and contribute to weight gain and hypertension. Sleep disturbances commonly seen in mental health conditions further disrupt blood pressure. Regulation. How obesity can cause hypertension. Obesity is linked to hypertension through various mechanisms, such as increased blood volume. It occurs due to the higher amount of adipose fat tissue, leading to increased production of substances that raise blood pressure. Inflammation. It associated with obesity contributes to endothelial dysfunction, narrowing blood vessels and further elevating blood pressure. Hormonal changes, such as insulin resistance and increased release of certain hormones from adipose tissue, also play a role in hypertension development in individuals with obesity. These factors collectively contribute to the intricate connection between obesity and hypertension. How OSA and hypertension are associated. Obstructive sleep apnea, OSA, is associated with hypertension through several interconnected mechanisms. Sympathetic nervous system activation. It is heightened during episodes of OSA, leading to increased release of stress hormones and elevated blood pressure. Intermittent hypoxia, a characteristic of OSA, triggers a series of physiological responses, including increased sympathetic activity and inflammation, which contribute to hypertension. Endothelial dysfunction, another consequence of OSA, impairs the blood vessel's ability to regulate blood flow and pressure. These factors collectively underscore the intricate relationship between OSA and hypertension. How mental health can result in hypertension. The connection between mental health and hypertension involves several interrelated factors. Stress response. Chronic stress activates the body's stress response, leading to increased levels of stress hormones and elevated blood pressure. Unhealthy coping behaviors. It often adopted in response to stress, such as overeating, alcohol consumption, or smoking, can contribute to weight gain and hypertension. Sleep disturbances. Additionally, sleep disturbances commonly associated with mental health conditions may further exacerbate hypertension. The intricate interplay between the stress response, coping behaviors, and sleep disturbances highlights the significant impact of mental health on blood pressure regulation. Understanding and addressing these underlying factors are crucial in managing and preventing hypertension in individuals with these conditions. Diagnostic tools. The diagnosis and assessment of the connection between obstructive sleep apnea, OSA, obesity, mental health, and hypertension often involve a combination of imaging studies and diagnostic tools. 1. Polysomnography, PSG, for OSA. Polysomnography is a comprehensive sleep study that monitors various physiological parameters during sleep. It helps diagnose OSA by recording airflow, oxygen levels, respiratory effort, and other sleep-related parameters. 2. Home sleep apnea testing. In some cases, portable devices may be used for diagnosing OSA, especially when PSG is not practical. Home sleep apnea testing monitors key parameters such as airflow, oxygen saturation, and respiratory effort. 3. Body mass index, BMI, measurement for obesity. BMI is a simple calculation based on a person's height and weight. It helps assess whether an individual falls into the category of normal weight, overweight, or obese. 4. Psychological assessments for mental health. Clinical interviews and standardized psychological assessments may be employed to evaluate mental health conditions. Assessments may include measures of stress, anxiety, depression, and overall mental well-being. 5. Blood pressure monitoring for hypertension. Regular blood pressure measurements are fundamental for diagnosing hypertension. Ambulatory blood pressure monitoring or home blood pressure monitoring can provide a more comprehensive assessment over a 24-hour period. 6. Imaging studies. Optional imaging studies such as MRI or CT scans may be used in certain cases to assess anatomical structures related to OSA, such as the upper airway. 7. Laboratory tests. Optional. Some cases may involve additional tests, such as blood tests to assess inflammation or hormonal imbalances related to obesity and mental health. Thank you for watching our video. Please don't forget to subscribe and like our videos.